In our today's lecture, we are going to discuss about food and nutrition, assessment of the community, assessment, policy development, and assurance are the three core functions of public health, whether at the federal, state, or local level. Assessment refers to the systematic collection, assembly, analysis, and dissemination of information about the health of a community. Policy development involves the creation of comprehensive public health policies based on scientific knowledge. Assurance is the pledge to constituents that services necessary to achieve agreed upon goals are provided by encouraging the action of others, by stipulating action through regulation, or by providing the service directly. Every public health agency must ensure that assessment occurs either directly or through intergovernmental or interagency cooperation. Accurate information on the health status of a community and a clear understanding of the available resources is requisite to making informed decisions about which areas should have priority, which policies might be effective, or which intervention might be possible to implement. Monitoring must be either ongoing or undertaken at regular intervals to provide a baseline understanding of the community's health in order to evaluate how well any new policies or interventions improve health, how cost effective one option is over another, or how long a program might continue. Community health assessment, of which assessment of food and nutrition status are an extension, includes always determining the health needs of the community by establishing a systematic process that periodically provides pertinent health information, investigating adverse health events and health hazards, by conducting timely investigation that identify the magnitude of health problems, including their duration, trends, location, and at-risk population, analyzing the determinants of identified health problems to discover the reasons why certain populations are at risk for adverse health outcomes. More specific, public health agencies, in performing their role of assessment, monitoring food and nutrition related health status to identify and solve nutrition related health problems. Activities of state and local public health agencies must include the diagnosis of a community's health status, identification of food and nutrition related threats to health, periodic collection, analysis, and publication of information on access, utilization, costs, and outcomes of nutrition services. Attention to the vital statistics and nutrition-related health status of the specific groups at higher risk than the total population. Three types of assessment focuses on food and nutrition related matters in the community. First is the nutrition assessment. Second is the food assessment, sometimes referred to as a food system assessment. And the third, food security assessment. The counterparts to the community nutrition assessment and food assessment would be the nutritional assessment and the diet history, respectively. The food security assessment collects the information to determine the extent to which existing community resources provide adequate, culturally acceptable foods to households in the area. The purpose of any kind of assessment is to collect and analyze the information in order to identify the problems and suggest solutions to ameliorate them. Assessment forms the basis for developing and implementing an individual's care plan or course of medical nutrition therapy. In the community, assessment forms the basis for subsequent program planning and evaluation. Regardless of the specific focus of the assessment or who initiate the process or assumes major responsibility for carrying it out, the goals of food and nutrition assessment in the nutrition and in the community are improve the health of people in defined area by building the capacity of local local health jurisdictions to reduce nutritional risk and promote optimal nutrition health of community members, raise the official awareness of food and nutrition issues to promote the inclusion of nutrition questions in local health assessments, and otherwise get food and nutrition issues on the local agenda. Determine how to allocate limited resources. Evaluate the efficacy of food and nutrition programs and services in the community. Identify current and potential food and nutrition problems in the community. Three basic kinds of information are gathered during any community assessment. These include a statistical community profile, qualitative data on the experiences of the population, and an assessment of local resources and assets. Asset-based approaches. This type of assessment recognizes and employs individual and community talents, skills, and assets rather than focusing on problems and needs. Such as approach imparts a sense of ownership to community members participating in the process. In every community, there are groups who care about nutrition, healthcare institutions, mosques, government agencies, breastfeeding support groups, schools, parents, and healthcare providers. A thoughtful compilation of assets prevent an assessment from becoming a compendium of morbidity and mortality statistics. The successful community assessment includes understanding current issues, confronting families and individuals, evaluating local capacities for supporting health and nutrition needs, and building community support for implementing changes. To conduct a community assessment, it is necessary to organize a planning group, define the community boundaries, gather quantitative data that includes a statistical profile of the community and community resources, collect qualitative data that reflects the food and nutrition concerns of representatives of key community groups, analyze and prioritize the common issues, high-risk individuals and populations, and unmet needs. A nutrition assessment of a community is initiated and implemented by the professionals to examine a broad range of nutrition-related issues and assets in order to improve the community's nutrition service system. The nutrition assessment is part of the larger community health assessment. During the assessment process, relationships are forged between individuals and organizations that may result in enhanced opportunities for collaboration and funding. An overreaching goal of the community nutrition assessment is a movement away from a categorical and programmatic view of the nutrition service and programs to a focus on the role of nutrition in the community as a whole. A nutrition assessment examines the health and nutrition status of community members, including pregnancy-related status, including pregnancy weight, weight gain during pregnancy and anemia, prevalence of disease affected by nutrition such as diabetes, cardiovascular disease and HIV/AIDS, physical activity and food-related behaviors, food intake such as amount of fruits and vegetable consumed, dental health and food security. For effective nutrition programming, planning and policy making, state and community leaders require timely, objective information on the current and changing nutrition condition of the population they serve. Providing such information is the goal of nutrition surveillance, which collects nutrition indicators from a representative sample of a particular locality. Examples of measurements used in the nutrition surveillance include self-reported height and weight, brief food frequency questionnaire. The inclusion in surveillance studies of questions regarding knowledge, attitudes, and behaviors can help in developing target strategies for dietary messages. Indicators of dietary practices in the community, such as comparing the amount of supermarket shelf space for whole versus low-fat and fat-free milk, may also be used. The problem identified through surveillance can help generate timely interventions. Nutrition surveillance comprises four types of activity: timely warning and intervention, problem identification, policy and program planning, and management and evaluation. A community food assessment is a participatory and collaborative process spearheaded by members of the community rather than health professionals. Community members, along with officials representing public and private agencies, examine a broad range of food-related issues and community assets in order to improve the community's food system. Through such an assessment, diverse stakeholders work together to research their local food system, publicize their findings and their action. A number of communities have successfully planned and implemented community food assessment, gathered a wide range of data and used the result to generate tangible outcomes. Their endeavor demonstrate that assessments in the diverse setting can generate a variety of results, including new policies and programs, as well as process benefits such as new partnerships and capacity development. A community food assessment relies on the participation of diverse stakeholders, including community residents, to plan and implement the assessment and emphasizes shared leadership and collaborative decision making. It fosters education and empowerment strategies such as training young people in survey methods. Significantly, this type of assessment focuses on meeting the needs of low-income and other marginalized population, examines a variety of issues and the connections between them, and generates specific recommendations and actions aimed at improving the local food system. Community food assessment includes four different components, which comprises of organization to identify key stakeholders, arrange initial meetings, determine the group's interest in conducting an assessment, identify and recruit other participants representing diverse interests and skills, and continue to coordinate and engage constituents throughout the project. Planning to review other assessments that have been conducted, determine assessment purpose and goal, develop an overall plan and decision-making process, and clarify roles, define the geographic population boundaries, and identify and secure grants, in-kind resources or project sponsors. Research to develop the questions and indicators identifying existing data and information needed, develop research tools, collect and analyze data and compile and summarize findings. Advocacy to discuss findings with community and develop recommendations. Create action plans to implement priority recommendations, determine whether additional partners should be recruited, develop media strategy, disseminate findings to the public, policymakers, and journalists. Urge policymakers and others to take action based on recommendations and evaluate the assessment projects. A community food security assessment more specifically focuses on communities at risk for food insecurity than does a community food assessment. A community food security assessment is a unique type of community assessment. It includes the collection of various types of data to provide answers to questions about the ability of existing community resources to provide sufficient and nutritionally sound amounts of culturally acceptable foods to households in the community. The USDA has developed a toolkit of instructions and material for conducting a community food security assessment. The kit contains standardized measurement tools for assessing various aspects of community food security. These tools focus on examining basic assessment components, profiling journal community characteristics, and community food resources, assessment of household food security, food resource accessibility, food availability and affordability, and food production resources. Despite varying goals and a somewhat different focus, any community assessment entails many of the same components. Problem solving can be distilled into four basic tasks: assessment, planning, implementation, and evaluation. It is a lucky break of nutritionists that these sequential tasks can be remembered using the acronym APIE, which is assessment, planning, implementation, and evaluation. When focused and faced with a problem, the first action one must take is to analyze the situation. Based on that assessment, the second step consists of planning a course of action. Next, the plan is implemented. Finally, the intervention's effectiveness is evaluated. The process can repeat itself as many times as necessary, with the result of the evaluation determining the plan for the next cycle. Community assessment is envisioned, planned, conducted, and used by the people living and working in the community. Representation from different segments of a community increases access to data, improves the likelihood of participation by their constituencies, ensures a focus on community concerns and goals, and can lead to positive and lasting changes. In addition to community representation, assessment participants should provide diversity, expertise and experience, availability, and a capacity for decision making. A team should have 8 to 12 members to be comprehensive without becoming unwieldy. Team members can be recruited from local government agencies, educational institutions, community and faith-based organizations, health providers, food retailers, residents, and farmers. It is imperative to convince the potential members of the importance of the assessment goals, the need for that individual's particular skills or knowledge, the clarity of the assessment plan, and the attention to implement change based on results. Health outcomes are improved through community empowerment, with empowerment domains defined to include participation, community-based organizations, local leadership, resource mobilization, assessment of problems, links with other people and organizations, and program management. Those with power or with access to it, and those who desire it, must work together to create the necessary conditions to achieve empowerment. As in a community assessment, once a team is gathered, it needs to work together to clarify goals and interests, agree on a planning and decision-making process, define the community to be assessed, identify funds and other resources, plan and conduct the research, prepare and disseminate findings, evaluate the findings, implement follow-up actions in response to the findings. Defining the geographical boundaries of the community to be assessed is fundamental to the community food assessment. Will you be assessing an entire country or smaller urban neighborhood? If conducting a community food assessment or food security assessment, consider the parts of the food system to be examined. Is the study wide-ranging, linking aspects of the food system to health or sustainability? Or is it more narrowly focused on food access in a particular low-income neighborhood? Knowing what and whom you are going to assess helps to refine planning and the development of tools such as surveys and questionnaires. Data collection is vital to the assessment process. Evaluation of results must be based on accurate and reliable information. When selecting data sources or developing questions for surveys, bear the goals of the assessment in mind. Not at all that all the data can be gathered will be pertinent to a particular assessment. It is important not to overlook useful data sources or replicate research. Data collection methods commonly used in community assessment include informal survey, semi-structured, standardized open-ended, focus group, or key informant interviews, community meeting or hearing, direct or participant observation, document analysis, photo documentation, community problem mapping. Some of these methods are discussed. Each has its strengths and weaknesses. The method to be used depends on an assessment's particular goals and the resources available. Community characteristics provide a socio-economic and demographic profile of the people in the community. It includes total population, age, ethnicity, household structure, employment status, income and poverty status. Demographic and socio-economic data such as these are some of the easiest to collect because they are assembled by federal, state or country agencies. Because these data have been systematically collected, they are almost always reliable and valid. Most are available on the internet in the local public library or from the state or country agency. Relying on existing information for the community profile is the least expensive way to gather statistics and provides consistent data that can be used easily for comparative purposes. Focus groups are an effective means of gaining additional insight into a community and for developing appropriate survey questions to be administered to a larger audience. One study conducted a series of focus groups involving specifically targeted segments within a multicultural community. Despite differences in ethnicity, age, and length of residence, community members voiced similar concerns about the advantages and difficulties of living in a multi-ethnic, multilingual neighborhood, about housing and other environmental issues, and other problems assessing healthcare. Participation in the focus group increased participation in other community endeavors. Members of each focus group should be fairly homogeneous and be familiar with the topic under discussion. A number of focus groups may need to be convened so that all subgroups within the defined community are represented. Focus groups are conducted by a trained facilitator using a focus group guide. Surveys aid data gathering from larger numbers of people than possibly through focus groups and thus help ensure representativeness. Survey responses are collected by interview, written response, or observation. Questions can be close-ended as in multiple choice, or scaled answers or open-ended, allowing the respondent or observer to answer freely. The Food Store Survey provided in the USDA Community Food Security Assessment Toolkit is an example of an observational survey. The observer can complete the survey at a store without direct contact with other people. Many surveys can be administered by non-professional volunteers trained only in data collection. Questionnaires used in nutritional assessment of individuals are generally, though not always, administered one-on-one by trained personas and are more costly and more time-consuming. These include 24-hour recalls, food diaries, and food frequency questionnaire. Communities need to be helped in identifying assessment methods that are comparable with other surveys. For example, when food frequency and food security questionnaires are used, asking the same questions as are used in the national surveys can help make local survey results comparable with national data. There are a variety of techniques to assess dietary intake, each with their own strengths and weaknesses. All dietary assessment methods are limited, and absolute validity is difficult to determine. This limits all researchers, and it sometimes makes sense to collect dietary intake data, even if the information is flawed. Keep in mind that collection and assessment of dietary intake is burdensome to subject, staff, and is very costly. Carefully consider how you will use the data and if it is really essential for your study. 24-hour recall is a retrospective detailed interview conducted by a registered dietitian to determine a subject's dietary intake from the preceding 24-hour period. The burden to the volunteer is low, but you have to collect serial recalls to adequately characterize usual intake. A quantitative assessment is possible with 24-hour recalls. In multiple day food diary, volunteers are asked to measure or weigh everything they eat for a specified number of days. Subject burden is high, but food diaries are useful for motivating people in intervention studies and are considered the gold standard in dietary assessment. A quantitative assessment is possible with food diaries. Diet history is an in-depth interview conducted by a registered dietitian to determine the volunteer's usual meal patterns and other details of dietary intake. Diet histories typically provide qualitative rather than quantitative information. The type of information collected can be tailored to meet the needs of your study. Food frequency questionnaires are standardized forms inquiring about the frequency of intake of different foods or food groups. They are not as accurate as other measures, but are useful in large population studies or when studying the association of a specific food and a disease. Several validated questionnaires exist, and the most appropriate one will depend on your study. Some questionnaires can be scanned and quantitatively assessed. Sustained economic and social adversity in low-income neighborhoods often makes it difficult for residents to obtain nutritious, affordable food. A community food resource assessment determines how well equipped the community is to meet the food-related needs of its residents. A profile of all existing resources must be created to determine the adequacy of the existing community food resources, pinpoint possible barriers to food security, and increase access to nutritious food in the community. Community food resources include retail food stores, farmers, markets, food cooperatives, and food assistance programs. Access to these resources depends on both their presence at reasonable distances from home and the ability to physically get to these resources using a private vehicle or public transportation. For key areas are investigated in an assessment of food resource accessibility and food availability include identifying retail stores and other places to purchase food in order to determine availability of authorized food stamp retailers, number, type, and location of retail food stores, number and location of consumer food cooperatives, number and location of farmers markets, identifying the number and location of schools that participate in the National School Lunch Program and School Breakfast Program, child and adult care food program providers, summer food service program sites, identifying the community's emergency food assistance providers, including the number location, times of operation of food banks, food pantries, emergency kitchens, commodity supplemental food program distribution sites, describing the rate of participation in federal food assistance program. The spatial relationship between housing and food outlets is an important part of community food assessment. Groups undertaking an assessment frequently prepare maps of the community to visualize the physical connection or disconnection between residents and various types of food sources.
Accurate measurement of household food security can help public officials, policymakers, service providers, and community groups assess the needs for assistance, judge the effectiveness of existing programs designed to help such households, and identify population subgroups with unusually severe levels of food insecurity. One main question drives this assessment: is household food insecurity a problem directly or personally experienced by a significant number of people in the community? One way to collect household food security data is to conduct a representative household food security survey. USDA's Guide to Measuring the Household Food Security, revised 2000. The assessment is predicted on the core module, a measurement tool developed to gather data on household food security. The core module has been used both in national surveys, such as current population survey food security supplement and in community food security assessments conducted on the local level. The module can form the basis for a sophisticated measurements of the severity of food insecurity as experienced and reported by household members. Local studies using either the 18 question core module or the standard deviation 6 items abbreviated subset can document the extent and severity of hunger in the community. Survey consists of questions about several genotypes of household food conditions, event and behavior. They include anxiety that the household food budget or food supply may be insufficient to meet basic needs, perceptions that the food eaten by household members is inadequate in quality or quantity. Reported instances of reduced food intake or consequences of reduced food intake, such as physical sensation of hunger or reported weight loss for adult in the household. Reported instances of reduced food intake or its consequences for children in the household. When used to collect the data on a periodic basis, the questionnaire can provide systematic monitoring of the community's progress in addressing hunger and other food security needs in the community. A community's agricultural system can boost the effectiveness of federal food assistance and education programs. Local agriculture can play a role in community food security when implemented together with a strong federal nutrition safety net and emergency food assistance programs. This can increase the availability of high quality, affordable food within a community, offering small farmers an opportunity to maintain economic viability by supplying the local market with fresh foods, strengthening economic and social ties between farms and urban residents, and channeling a larger share of residents' food spending back into the local economy. Several key questions might be asked in an assessment of food production resources, such as does the community have food production or food distribution resources? Do low income households have the opportunity to participate in community gardens or other food production activities? Are there any school based gardening programs? Are locally produced foods sold through local food retailers and restaurants? Does the local school district purchase foods from local producers? Are locally produced foods used by other institutional food service outlets such as colleges, prisons, and hospitals? Unfortunately, the scope and scale of an assessment is often determined by the available budget. Volunteers and in-kind resources can reduce the actual cash outlay needed to conduct an assessment. Some expenses must be met directly. Some assessment expenses to consider include site and refreshments for meetings, reimbursement of participation in community outreach, support staff, research personnel, office space, phones, photocopying, fundraising, printed materials such as survey forms. Funding for community assessment is difficult to obtain at the federal level. Although the Community Food and Nutrition Program has funded some projects, as has the Community Food Projects Competitive Grants Program, Community Development Block Grants, and Food Stamp Nutrition Education funds might prove fruitful sources. Government agencies dedicated to nutrition, health, or community development, for example, may provide some assistance. Community and other private foundations, if you frame your assessment goal to match their interests, may also help with funding. Analysis of data in both quantitative and qualitative, the approach used depends on the assessment goals, whether to compare your community to national data or to develop an action plan to improve food access. Presenting this data to stakeholders, policymakers, and the general public is integral to the assessment process. The presentation should be easy to understand with graphic displays such as maps and tables used whenever possible to clarify and amplify narrative presentations. Demographic profiles of power country ID and that of the state as a whole plots the location of food markets on a map. An assessment report that incorporates the data analysis can assume many identities other than that of a written report. A series of newsletter articles, a media or policy brief, a research or professional paper, resources guides or databases, a community presentation, or a study guide. Regardless of the form the report takes, it should include an overview of the community and its food system, a description of your assessment process, highlights and discussion of key findings, and recommendations for change. The ultimate purpose of an assessment is to make positive change. Once an assessment is complete, the same journal process, although focused on change called for by the assessment, will need to be repeated. Types of action might include, for example, community mobilization through door-to-door canvassing, community education through media coverage, or bilingual brochures, programs, or activity development, and public policy advocacy. A recent innovative instrument for advocacy is the Food Policy Council. What is Food Policy Council? A Food Policy Council is a coalition of food system stakeholders who advise a city, country, or state government on policies related to the agriculture, food distribution, hunger, food access, and nutrition. These policies are often fragmented. Food policy councils exist to examine these issues in a more holistic fashion, obtaining unknown information about the food system and also developing projects and policies to improve it. Current councils serve as advisory commissions to state and city governments within departments of health and as non-profit organizations. Members may be appointed by the council or by government officials and often include farmers, food processors, wholesalers, distributors, anti-hunger advocates, community leaders, representatives of government departments, cooperative extension agents, and concerned citizens. These diverse coalitions often must educate themselves about their members' specialities and overcome their stereotypes in order to be effective. Policy councils address a variety of issues. They are often created in response to a pressing need. Food policy councils perform a variety of tasks, from researching food production, food access, and nutrition in their area to designing and implementing projects and policies to address those issues. Some examples include creating bus routes that connect low-income neighborhoods to supermarkets, developing the nation's first municipal food policies, supporting school nutrition programs, including supporting kitchen renovations to allow kitchens to process fresh foods, determining how to use of locally grown foods in school meals, and advising teachers and administrators on school breakfast implementation. Publishing a state roadmap that includes most farms and other sources of locally grown foods in the state with small description of each site. Mobilizing farmland preservation efforts. Monitoring grocery store prices and discouraging the differential pricing that disadvantages low-income neighborhood. Educating the public and policy makers about food, nutrition, hunger and agricultural issues through discussion groups and position papers. Geographic information system are computerized system for the storage, retrieval, manipulation, analysis and display of geographical referenced data. This technology provides a useful way to map and display spatial and temporal relationships. Geomapping is a valuable tool for conducting needs assessment, targeting specific populations for outreach, and examining programs outcomes. NGIS can include physical, biological, cultural, demographic, or economic information. It is a valuable tool in the natural, social, medical, and engineering sciences as well as in the business and planning. Public health professionals, policymakers, and others use GIS to better understand geographic relationships that affect health outcomes, public health risk, disease transmission, access to healthcare, and other public health concerns. GIS is being used with greater frequency to address neighborhood, local, state, national, and international public health issues. For example, the Centers for Disease Control and Prevention uses GIS to provide maps and data on public health issues. Many of the CDC's efforts are based on online maps. These maps may be manipulated in many different ways. Geographic data in A GIS consists of a series of map layers that contain information about features located in specific locations. GIS links multiple sets of geospatial data and graphically displays that information as map, with potentially many different layers of information. Assuming that all the information is at the same scale and has been formatted according to the same standards. Users can overlay spatial information about any number of specific topics to examine how the layers interrelate. Each layer of a GIS map represents a particular theme or feature, and one layer could be derived from a data sources completely different from the other layer. One layer or theme could represent all the streets in a specified area. Another could correspond to all the buildings in the same area. And other could show vegetation or water resources. Additional themes could be census, tract boundaries. A community assessment project in MS used GIS to select survey centers for a target population, evaluate sample representation, and perform geography-based community health assessment. Survey centers focused on either a general population or a specific group within the population. Potential survey centers were overlaid on block groups to verify their location as a center. Only after the center for a target population had been identified were in-person surveys conducted. Geographic representation involved address geocoding of participants, residences, and analysis of the geographic distribution samples in relation to the selected survey centers, demographic and economic characteristics of the country. Maps were created to depict the geographic distribution of variables such as health status, healthcare access, availability of transportation, and types of healthcare facilities available. Conducting a community assessment, whether it focuses on nutritional status, food access, or food security, involves a tremendous commitment of time, energy, and resources. Yet there is significant payback in terms of heightened understanding of the assets and barriers that exist within a community. It is important to approach an assessment with clearly defined goals, to seek active participation from the diverse groups within the community, and to plan to create positive change. Numerous tools are available to collect, analyze, and present the data. The tools selected depends on the goal of the assessment as well as available funding. Most significantly, the information and knowledge attained through an assessment is only as useful as the change it implies. The purpose of any kind of assessment is to collect and analyze information in order to identify problems and suggest solutions to ameliorate them. In the clinic, assessment forms the basis for developing and implementing an individual's care plan or course of medical nutrition therapy. In the community, assessment forms the basis for subsequent program planning and evaluation. It how central food is to our lives. Most of us know very little about where the food we eat comes from, how it is grown, and how it reaches our plates. This lack of knowledge is true not only for individuals but also for communities as whole.